And so no surprise here, teams are already mobilizing on the ground to help people in Puerto Rico try to recover from Fiona's devastation.
Yeah, the International Medical Corps has already mobilized groups on the ground for the past 5 years since Hurricane Maria hit back in 2017. Now, what kind of impact will Fiona have on their efforts? Well, head of U.S. programs with International Medical Corps, Tavares, joins us now. And I would imagine, Erica, that, well, it's going to have a big impact.
It is. Our teams are on the ground now assessing the damage and really getting out and talking to our partners. We're working with local hospitals, local health facilities to really understand what some of the needs are going to be. As you've been reporting, it is still raining. There's considerable and catastrophic flooding along the eastern and southern parts of the island. Power is out for most people. We're also hearing reports of water being out as well. And so the needs are dire. And unfortunately, we're sort of, almost 5 years to the day right after Hurricane Maria that they're facing this devastating storm again.
And, one of the things we do talk about, and it is so relevant to what's happening in Puerto Rico, is that Maria hit just about 5 years ago, as you mentioned, yet still some communities were trying to recover or haven't recovered Maria. Now we have Fiona coming in. So you've been there since Maria hit. Are there any differences, any similarities that you've seen? Almost like we're piling up storms in some cases.
Right. Thanks. Yes, I don't think we can underestimate the impact of repetitive loss. These are communities that have faced crisis after crisis. Certainly Hurricane Maria. There were earthquakes in 2020 where families were still displaced when Fiona hit today in the southern part of the island. And so these families are still trying to recover from those earlier crises, those earlier storms, and the needs are growing. Our teams on the ground have been providing mental health services for most of the last 5 years. We saw after COVID-19 the request for additional mental health services increase, and now we're just anticipating that those requests are going to be even greater.
Well, we're seeing some of the footage here, but just in your words, what have they been reporting back as it pertains to some of the damage that they've suffered? I mean, obviously, a lot of the island is simply flooded over and everything's underwater.
Correct. Everything's underwater. The governor's asked people to remain at home to the extent that they can because the flooding is so treacherous. The threat of landslides is so great. As I was saying earlier, power, it does remain out. Water services do remain out. And so we have staff members who are in communities that are inaccessible now. They've had bridges wash away, and emergency responders are on the ground and really trying to get to them and to get access to those communities again.
And let me ask you, too, I mean, your teams have been there for now 5 years or so. How are they doing? There is an emotional toll to this for the people that live there and for the people that are trying to help these families keep their lives together.
They are. Thank you. Yeah, they're safe and accounted for. Of course, we first and foremost make sure that our teams on the ground are safe. They're now reaching out to partners. They're connecting with health facilities and with community organizations that we've been working with for the last 5 years, some of whom have been affected themselves. And I think whether it's our teams or it's the first responders who are on the ground, these are individuals that have to make sure that they can not only respond to the needs of others, but they're taking care of their own family's needs. And so for us as an organization and as responders, we want to make sure we get them the resources they need so that they can respond, keep their own families safe, keep health facilities open and resources available for other families on the island.
You just hate to hear about a double whammy like Maria and Fiona in the same part of the world that's so beautiful, right, and has such vibrant people. Head of programs, U.S. programs with International Medical Corps, Tavares, thank you so much for your time.
Thank you.